Let's bring in the president of the American Medical Association, Dr. Patrice Harris. Dr. Harris, we're trying to figure out why this drug is being so aggressively pushed by some, including the president. Where does the AMA stand on this? What are doctors saying about whether this drug should be prescribed?
Well, certainly from the AMA's standpoint, we support clinical trials. We need to make sure we have efficacy data. We may find, and everyone is hopeful, that we will find some medication for treatment. But it's also so very important to know the risk profile. As a psychiatrist, I prescribe medications every day, and though the risk of death, a very, of course, severe outcome might be minuscule, it is my obligation, and my patients expect me to talk about the full range of side effects, and we just don't know. We really have to make sure that we allow the clinical trials to proceed, and then based on that data, we can move forward.
So what's the business side of this and the clinical trials? How long do they take? Can they be moved up given the situation? What would be the reason to push this drug out there sooner? What would be, I guess, the motivation behind those who are pushing it?
Well, I can't speak to the motivation behind those who are pushing it, but in an address that I gave yesterday, I encouraged everyone at all levels to make sure that we are following the science. Again, we all want to find a cure, but we have to make sure that it works, number one. And number two, we have to know the side effect profile. We have to know drug-drug interactions for this particular coronavirus, this new coronavirus. Yes, this is approved for malaria. We also know that it works well for those who have lupus and arthritis. But we have to make sure that it works and we understand the full side effect profile for coronavirus. And I also want to say that there is great concern that because of drug shortages now with hydroxychloroquine, that our patients who have lupus and have arthritis cannot get the medication. So we really have to be very thoughtful and make sure we follow the science and the evidence.
Mike Barnacle has a question. Mike?
Yeah, doctor, years ago, this is basically a malaria drug. Years ago, I was on this drug. And to my memory, and I'd like you to respond to this, given the level of misinformation that we often get, sadly, tragically, from the President of the United States, his story that he just related, that we just heard about the husband running out to the drugstore at 10 o'clock at his then supposedly dying wife's request, please go get this drug for me and come back and we'll try it. Is it not a prescription drug? Do you not have to have a doctor's prescription to get this drug?
To the best of my knowledge, you do need a doctor's prescription, and when a physician would prescribe this medication, we know that, and I certainly can't speak to that particular case, but I would just say, yes, you need a prescription to get this medication, and when physicians decide on any treatment alternative, they are not deciding based on a whim or an opinion. Even for compassionate use, even oncologists who are thinking about compassionate use at the end of life, they are still basing their recommendations on science and the evidence, not whims or personal opinions. And that's where we need to stay regarding COVID-19 or really any illness.
Dr. Harris, it's Willie Geist. I want to ask you about the state of supplies moving into hospitals and what you're hearing from your doctors. I've heard from some doctors in New York City that the PPE question is getting a little bit better, that they don't have enough for the long term, but they have enough sort of day to day and week to week, and they hope more will be coming. Ventilators still not quite enough in some places. Where are the needs as you see them, and where are they likely to continue? Let's say things stabilize in New York over the next couple of weeks. We certainly hope that's true, although we don't know that it will be true. Where will the need be as you look out across the country?
I'm hearing those stories too regarding New York, and I think that that's a testament to the folks in New York and even the governors and states around New York at least getting together and mobilizing and trying to make sure they have some data and some evidence, and then based on that, getting the supplies that they need. I can't speak to other hospitals across the country as to what they need and what they will need at the peak. And that is the critical missing piece here. And that is why, again, the AMA from the beginning called on the president to invoke the DPA. And part of that would be to have a tracking system, a federal tracking system, so that you would know who has need at what time, and so you could mobilize and get the needs or get the supplies to the areas that need it most. And so we really need to make sure that we are doing that, because certainly New York may be at their apex. We don't know where the next hotspot will be, and we really have to have a national system to be able to be proactive and predictive.
Dr. Harris, we're seeing some staggering numbers around coronavirus and race. In Chicago, for example, 70% of the cases are among African Americans. Milwaukee, it's 72% of the cases, far outstripping the African American population percentage in those places. The state of Louisiana is another one. Dr. Fauci talked yesterday about the prevalence of underlying conditions among African Americans, whether it's hypertension or diabetes. Can you speak to how specifically the country can address this problem?
Yes, those numbers are startling, but unfortunately not surprising, because we were pre-COVID-19 at a state where there were significant health inequities in this country. And so one of the things I think we need to make sure we do is collect the data. You mentioned a few states, and so we know that a few states are collecting the data by race and ethnicity. We need every state to collect the data and then disseminate that data, and then we'll be able to track that data. For instance, we do GPS mapping all the time and tracking. Could we overlay that data over zip codes, and then we will know who needs what? And then the second phase will be testing. We need to get into the hardest hit communities and where we see these inequities and make sure all of the forms of testing are available, particularly the rapid test results and the antibody test. So those are two high priority areas we need to address as we look at these huge inequities. And that's the short term. We will get through this as a country, and we will not and should not forget these inequities. Again, many of us were already working on these. We are at the AMA. We have a new Center for Health Equity, and we will have to have a longer term strategy to address these continuing inequities.
All right, President of the American Medical Association, Dr. Patrice Harris, thank you very much. And as we close today, just want to urge the American people to really pay attention, because chaos, confusion, desperation mixed with corruption is a really bad, dangerous mix. That does it for us this morning. Stephanie Rule picks up the coverage right now.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.